This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches. Hey guys, welcome to Healthcare Snitches.
Welcome.
We have a really good topic for you guys today. But first, Jasmine wants to say what she always say.
I don't want to, but I'll do it. So make sure you like and subscribe to our YouTube channel, Healthcare Snitches. Also follow us on social media, TikTok, Instagram, Facebook, LinkedIn, MySpace, Black Planet. Just kidding.
Wait. I was like, wait, what? LinkedIn?
All of them. And make sure you like and subscribe and turn on your notifications so that you know when we post.
Which
every
is
2 weeks.
Every other Sunday. So this Sunday will be a new episode. Mm-hmm. And make sure that you guys tell your friends and your family. There are times when you tell people and they actually do come on and they do subscribe and they do like it. So tell your cousins, your friends, your enemies, your frenemies,
your aunties, your uncles,
everybody.
The people that need to hear this, because I feel like we drop a lot of knowledge and not sure if what we're putting down is being picked up, okay? Because based on the views and the subscriptions,
I know. There's so many lost souls out there.
Yeah, and the people that I have told the podcast about that listen to it are really saying it's informative and learning new things. And quite honestly, we have to take control of our health, especially with changing governments and as we get older, just everything else. We have to take care of ourselves. We have to take care of our parents, our children, our partners. And it's just helpful information that we're giving out. And that's the reason why we started this podcast.
Yep, because there's so many people who don't know things that they should know. And we're here to help educate. Yeah. And we're also trying to minimize the phone calls.
Yes. Well, I don't really get any, so
I get a lot of phone calls, but I'm always here to help people. I am. So anyway, today's topic, child,
it's fun.
It's going to be it's actually not fun.
It ain't fun. Yeah,
for the homies or for us.
It's not. You're right.
Yeah,
you're right.
But we are going to be discussing erectile dysfunction, which is also known as ED. So if you hear me say ED during this podcast, understand it's erectile dysfunction. So you want me to take it over?
I mean, whatever, girl.
Okay, so this is from Johns Hopkins Medicine. So you know it's the truth because they'll be playing with Johns Hopkins. So erectile dysfunction is the persistent inability to achieve or maintain a penile erection sufficient enough for satisfactory sexual performance. So that means that either you cannot get hard or you get hard and during the whole process, you lose it.
Yeah, you can't stay.
It's dysfunctional. That's how we would like it to be, solid as a rock. Okay? But it's not always like that. So, a lot of times men just brush it off, right? But it can also cause a female to feel like she's not attractive.
Yeah.
Right? Like, are you not erect because you're no longer attracted to me? You never were attracted to me. I'm not doing it for you anymore. Like, it can really hurt a relationship, in my opinion.
Yeah, I mean, I am not to spill all my own tea, but it definitely.
Girl, wait, pour it. I got the water. Pour your tea.
But it definitely makes you feel like, what's happening here? And also, it goes from like concern to kind of disappointment to being pissed off. Okay, that's on the female end, because a lot of times, not even a lot of times, 100% of the time, it's coming from something, right? It's coming from some type of condition, and I don't know if you found in your research if whether it's like an age range that this could happen to, or because you don't really.
Anybody.
I mean, I didn't really notice this in the 20s and the 30s,
things that are not linked,
early 30s.
Things that are not linked to a like health condition would be stress, a person being extremely tired, drinking or consuming too much alcohol, smoking too much marijuana, and also side effects from medication can also cause erectile dysfunction. So those are the exceptions.
Well, how much is too much?
I don't know.
Alcohol and marijuana. Also,
I don't know.
Also, just to add on top of this, it can also be that the quality of the erection is not good, right? So not that they can't get one, but it's not as hard as it could be. If
the quality is not good, I'm going to use your line. Get somebody else to do it.
But that's also a part of erectile dysfunction, right? Because some people may think it's just that I can't get hard or it doesn't stay hard, but it's also if it's mushy.
Then it's not technically erect.
I mean, you're right, but it could be enough to the point where they feel like, because in their mind they might feel like it is hard.
No. My thing is come correct or don't come at all.
They think they come in correct, though. That's the thing. In their mind, it is.
Sound like they need a therapist.
Yeah, some of them do, because it can be causing the issue.
Yeah. So, from my research today, many conditions can cause it, such as high cholesterol, diabetes, high blood pressure, and I just want to pause there for a second. You guys need to understand those 3 ailments that I just named can easily cause circulation issues, right? So if you have circulation issues and all of your organs are not being perfused properly, the heart is not perfusing properly, how is it that blood is going to rush to the penis and get it erect?
Dang, you did that hard.
That's how we like it. So it's
you ain't lying.
So it's not going to get erect. So if you have hypertension, high cholesterol, or the sugars, you might need to get that under control because that's the foundational issue.
But I just want to say that if you don't, so this stems back to our episode 1, 2, every episode before this episode. If you don't have a PCP, then you most likely are not getting your regular checkups, and you're not going to know if you have any of these issues.
Because you're walking around with it, you're not being diagnosed.
Yeah, you're walking around with it, and next thing you know, you just feel like, oh, I have ED. No, you have high cholesterol.
And you have circulatory issues, okay? Which you might want to look into if you have high cholesterol. You don't want no plaque.
Right, because ED is going to be the least of your issues.
You're going to end up in the ED.
Right.
When you go into cardiac arrest.
Exactly. When you having a heart attack, you mad because you can't get an erection.
Yeah, how you doing? You see how that just trickled down like that? Ooh, girl, we done passed the peas like we used to.
Yes, I can.
So, other issues that can also cause it is depression, anxiety, or hormonal problems, such as low testosterone.
Yeah.
Right? If you are a man and you have low testosterone, you might need testosterone replacement. Because if you don't have testosterone, you might as well have a cooch.
Dang. Well, I feel like I be having some testosterone, but
you got facial hair or something? What is going on?
I mean,
your voice is changing. What's up?
No,
Ernestine.
I don't want to put all my business out there, but I have PCOS and I do get like facial hairs, but that's why I get the laser. That's why I get the laser. So I might be walking around here more than y'all, but some other conditions that may cause it is obesity, Parkinson's disease, apparently.
Yeah.
MS.
Those are neurological.
Yeah. So everything is connected. You already said, did you say the sugars? You said diabetes, hypertension.
Yeah. Those were the three with the circulatory issues.
Okay. I think you kind of like clog blood vessels.
Yep.
Which is all these things lead to that.
So then the blood is not flowing properly.
Yeah, it's not. And tobacco use. So in addition to smoking the weed,
which causes
tobacco
circulatory issues.
So it's all connected.
It is.
And you said alcohol. If you have any sleep disorders, so if you have insomnia, narcolepsy, any of those things, if you're getting any treatments for prostate cancer or an enlarged prostate, if you've had any surgeries or injuries to your spinal cord.
Mm-hmm. When Boo had his surgery, the spinal surgeon warned us that don't be surprised if he has erectile dysfunction caused by it.
Ooh.
Yeah, that's what they said. We were good. But he just said that that's like a possible side effect.
Like, would it be permanent, or was it just going to be like a temporary thing until he was
I don't
done
even
healing?
know.
Well, I'm glad that didn't happen, child.
I don't know. Yeah, don't nobody want no mushy beep.
No. Dang. Not bleeping yourself out. I can't. And you already said stress. Stress and stress.
Yeah. So
stress kills. That's episode, I don't know.
Something that we already did.
Right.
So one of the things that a person with ED, well, not one, but some of the things that they can do is if you are obese, lose weight. If you smoke tobacco, stop smoking. Eat a healthy diet. Try to eat a healthy diet. Also, exercise daily, right? And try to reduce stress and anxiety. So sometimes when men have relationship problems and their relationship causes like a whole bunch of stress, that can contribute to ED for multiple reasons. It's stress, it can lead to depression, and who wants to be intimate with a person that they're always going head to head with?
Yeah,
right?
You don't. I mean,
well, for me, I wouldn't.
Well, yeah, because we care about that stuff, but also this brings up a good segue into what I kind of wanted to like talk about. So I think a lot of people don't necessarily take men's feelings seriously, and even that they don't take their own feelings seriously. So they feel like, whatever, like, I don't care. You'll hear them say, I don't care, or
like how they brush everything
off.
Yeah,
they brush everything off, but that impacts you. Like, it's still on your shoulders. It's still in your mind, and that is stress. And so
if they are like just harboring everything in.
Yeah. If they're harboring everything in, if you got stuff going on at your job, that is all part of the stress that's going to impact the way you show up in your relationship and also in the bedroom. So, like, you need to, like, alleviate your stress. And I know it's, like, a double-edged sword or whatever because, you know, having sex will help you do that. But if you can't get it up,
right,
then you can't have the sex.
Right. So what do
what you supposed to do?
Yeah.
Because I feel like all the medications that, you know, there's medications. There's Viagra. You got to get the section for that. So all those medications are really to fix the problem, but, like, why aren't we fixing the underlying issues?
So if you go to a urologist, they are going to, for sure, give you a resolution for the ED. They're not going to dig deep. If this patient has high blood pressure and they see that on their chart, okay, they got high blood pressure. Will their high blood pressure medication have an issue with this? If not, let me just give them this. They said, hey, I'm sticking to my scope of practice. I'm not focusing on cardiology stuff. I'm focusing on penile issues over here.
I feel like they need to think about that too, though, because I mean, which they do think about, I guess, when they're looking at the meds.
They just don't want the person to die from the interaction.
But isn't that something that happens commonly?
What?
If you're on one of these meds, like, what do they interact with?
So, like, if you are on hypertensive medication, right, and you're on beta blockers, in my opinion, you should not take Viagra, go have sex, and then 2 hours later take your beta blocker, because the Viagra can cause a drop in the blood pressure. Once it wears off, it's going to cause a drop in the blood pressure. So you have to, like, be careful. Like, I wouldn't take those within, like, a 6-hour window of each other. if I were these people. So yeah, so these are things that these urologists need to be educating these patients with, and the doctors who are like PCPs, who are not just sticking to their scope of practice, but they're like, oh, you have ED, let me prescribe you this. I hope that they are doing the patient education as well.
I hope that they are too, not just being like, take this pill, you know, your merry way, have fun.
Which you know some doctors do.
Yeah, and like, good luck. Because I know a lot of these, I see commercials where they're like, oh, you just got to call us if you want these pills to get it popping, you know.
So you don't need a doctor? You normally need a prescription.
Yeah, well, they're the online clinics.
Oh, so their doctor will.
Yeah, so you'll see like a nurse practitioner or something, and you'll have like a virtual visit, and then they'll mail the pills to your house.
That sounds like a good job for a nurse practitioner. Let me go on back to school.
They doing it for that, and they doing it for hair, like restoration. It's a whole thing, because usually once you start needing the pills, you start needing the hair stuff too. Usually.
When do you start needing teeth?
apparently that's now. Okay, with the way my stuff is set up, the way my teeth is set up, at 12.
You're so stupid. Okay, so you should go see a doctor, as we already stated, if you are having erectile dysfunction, because you can't keep saying, oh, it's because I drank too much last night. Oh, it's because she pissed me off and I wasn't interested. No, you could have an underlying issue. So you should definitely go see a doctor.
Go see your PCP first, right? And then have them refer you to a urologist if they don't think it's the cause of your like hypertension, right, diabetes, or something else.
So when you go to the doctor, what they are going to do is they are going to run multiple tests. You're going to get a physical exam. You're going to get blood work done. They're going to do a urinalysis. They are going to do an ultrasound possibly, just to make sure that there's nothing in the anatomy that is causing this. And they are going to also do a psychological exam. This is what a good doctor will do, all of these things, so that they can figure out like what is really causing this. Is it something mental? Is it something physical? Is it something with your anatomy? They will figure it out.
Yeah. So I guess what Kim is saying is that they should do this.
Yeah.
Okay. Not that they will. And if they don't do this, find yourself another PCP.
They should do it, especially before they so-called treat it.
Yeah.
Wait, where's my other fingers? This way. Okay.
I know.
Before they, like, I had to figure it out. You said that it's reversed this time, right? Oh, okay. All right, so before they treat it,
out your fingers.
Right? They should do all of this research to figure out what's going on with you.
Yeah. Do you think a lot of guys
are embarrassed to go?
Are embarrassed to bring it up when they go to the doctor? I know, because like at this point they're trying to like save something. Most likely, if they're making the appointment and they're going in, they've been pressured by probably their partner to be like, hey, I'm not putting up with this, you know, go get this fixed. Or, I'll be quite honest with y'all, I hope this person has gone to the doctor by now, but it kind of felt like he was just going to keep
passing the mushy
right to the next person until they get tired of it, and then just keep mushing it around. But this is too much.
I think that if you're in a relationship and if you are genuinely concerned, like you and I are borderline hypochondriacs, so I feel like if you have the right partner, you can be like, hey, something's not right. It's never been like this before. Let's go to the doctor together.
Right.
I think then a man would be more willing to go because he has the support of his spouse, his partner, his wife, whoever. If you just like, I'm not dealing with this mushiness, go to the doctor, figure this out, then they probably won't want to go. They're probably embarrassed because it's kind of like they were told in a demeaning manner.
Yeah.
Right?
Yeah. I would never say it like that.
Of course you wouldn't. Especially for the Jasmine that you used to be.
Right.
You would never.
But
now, I don't know.
I don't know. Yeah, I am a little savage now, so I may tell you to go on ahead with your mushy self.
You might say, go on ahead, have a nice life. It's been real, but I'm not dealing with this mushiness.
Right. Like, figure that out. But
call me when it's hard.
You won't be figuring it out with me.
Yeah. Yeah, I can see that.
You said call me when it gets hard?
I'm just
actually
don't. So some of the medications that they may prescribe is Viagra, Tadalafil, which is also Cialis. Vardenafil, which is Levitra.
Hey, Levitra.
And Speedra.
That just sounds like
which is Avanafil. So all of these can be prescribed, but not all of them. They'll choose one of the fills. And what people need to understand is you can't pop a Viagra and then 2 minutes later be walking around like, ooh, I'm erect. No, you also need sexual stimulation with this.
Oh, it doesn't work like that?
Nope.
I thought it was just like, oh, you take...
Nope, you need sexual stimulation.
Oh, okay.
And I think that that's a misconception that a lot of people have, is that you pop this pill and it's going to be on and popping. And it's going to be on and popping. So, so you have to...
So how long... Okay, so you take the pill, and then, I don't know, you have a lot of notes over there. How long after you take the pill do you have to wait to have...
Normally within 30 minutes, because it has to break down.
And if you wait longer than 30 minutes, do you have to like take another one, or like how does that work?
But for some of these prescriptions, like I know Cialis, I believe that you can take up to a certain amount. I'm trying to remember from nursing school.
Before you die.
I think that you can take at one time like up to 4 or 5 of them. Yeah.
Ooh.
Because just one may not work for you. And how you know that it's working lots of times is the side effects. So you'll have you can have like flushing, like where you feel really flushed, like a real stuffy nose, very very so
that's
nasal.
How you know it's working.
Yeah, because these are side effects. Yeah,
okay, I get it.
So your blood vessels are beginning to constrict.
Ooh.
Nasal congestion, headache, visual changes. So you may not be able to see, but
that's a lot, right? That's a lot just to get a whole.
Just to bust a nut. Yes. Visual changes, backache, and upset stomach. So these are all things.
Backache and upset stomach.
Yes, girl. These are all things that can possibly cause it. But like Jasmine said, again, if you have high blood pressure, if you have hypertension, that's high blood pressure. Sorry,
I'm done.
If you have high cholesterol, high blood pressure, or diabetes, and you keep having erectile dysfunction, I second what she said. Go to your doctor. Find out if it's the diabetes or one of these other things causing your issue. Because maybe if you fix those issues and get those issues under control, then ED won't even be
a factor.
I
did read, however, that even if you have an underlying condition that is causing it, you may still need, and they're managed, and you're managing
medication.
You still may need the Viagra and such.
Yes. But if, let's say you 600 pounds and you got super high blood pressure and you get gastric surgery and you go down to like 250 pounds and now your blood pressure is no longer high, it's a possibility that you might be standing strong.
Right?
Yeah.
Tune in next time for more snitching.